Hi, my name's Will. I'm a nurse here at On-Site. Today I'm going to go over with you how to assess and document a back injury. Back injuries are one of the most common injuries we see here on site. And when I start my assessment, I actually start it when I first lay eyes on the patient. I want to notice, is the patient limping? Is the patient hunched over? Does the patient seem like he or she is in horrible pain? When I have the patient come in, one of the first things I'm going to ask is, how did this happen? I want to know the mechanism of injury. So that could give me an idea of some of the things to look for. And it can also help me decide if this is an injury that needs advanced medical treatment right away, or this is something that we can treat here in the clinic. So I'll have the patient come in. I'll usually have them have a seat in a chair. And I want to start by asking them their level of pain, where their pain is at. One of the most important questions we ask is, do they have any numbness, tingling, things like that that could indicate a problem with their nervous system. So I want to start with a visual assessment of the patient's back. So at this point, I'm looking for any signs of trauma, any deformity, swelling, abrasion, or lacerations. I can also do a hands-on assessment of the patient's back at this time. Really what I'm looking for is any tenderness on palpation. Some other questions I'm going to ask when assessing the patient's back relate to any involvement of their nervous system. One of the most important questions I'm going to ask, and it may be kind of awkward, is I want to know, do they have any loss of bowel or bladder? Are they having any issues controlling their bladder? Because that can indicate a serious problem with compression of the spinal cord. I'm also going to assess for any numbness, tingling, changes in sensation in their extremities, which I also want to assess the patient's range of motion. And I'm going to do that by having the patient lean forward, which is what we call flexion. And lean forward for me. Okay. And come on back. So what I'm looking for is the patient able to lean forward? Is the patient able to perform that range of motion to the level that he or she normally is able to do? Is there an increase of pain with that specific motion? Is there any change in sensation or numbness and tingling with that motion? Are they difficulty doing that? Do they need help to come back up to a fully upright position? So I'm also going to do the same assessment, just extension. So I'm going to have you go ahead and lean back. Okay, and come back up. So each time I have the patient perform these range of motions, I'm going to ask them the same thing. I'm going to ask them about numbness, tingling, pain, and difficulty. The other range of motion we're going to assess is lateral bending. So we're going to begin from side to side. Right, if mind bends to the left for me. Great. And then we're also going to do lateral rotation. Wonderful. But we're going to be looking for the same things that we look for our other range of motion exercises. As part of our assessment, we want to assess patient's reflexes. The two reflexes we want to assess are the patellar and the Achilles reflex. We test the patellar reflex because that problem with that can signify an issue with the L2, L3, and L4 nerve root, where with the Achilles test and signify a problem with the S1. So to assess the patellar reflex, we want to strike a patellar tendon just below the patella. Now, that was a good reflex. So that's what we want. Foot. We want to place our hand under the patient's foot to provide a mild amount of plantar dorsiflexion. Next, we want to strike the patient's Achilles tendon. And as you can see, we got a positive reflex. That's what we're looking for. I also want to ask about the patient's pain. I want to assess the nature of the patient's pain. Is it burning? Is it dull? Is it sharp? Is it staying heat? Or does the pain migrate anywhere? Or does it stay in one place? Which movements provoke the pain? Which movements make the pain better? I want to listen to my patient. I want to listen to understand. Next, I want to go over the treatments that we can provide each flank. One of the treatments that we could provide is ice therapy. We can immediately apply an ice pack to the area, and this will help relieve many of our patients' pain. We can also provide over-the-counter, non-steroidal anti-inflammatory drugs. Typically for back pain, we use ibuprofen as it is the anti-inflammatory as opposed to acetaminophen. We also have pain relieving gel that we can apply to the area. This is typically very effective for muscle strain. For severe low back pain or back pain with signs of nervous system involvement, these patients want to be referred out for advanced medical care. Patients who had a back strain or a suspected strain, I typically want to follow up with them the next day. I just want to kind of keep on top of things just to see if they're improving or their symptoms are getting worse. If they're improving, then I'll typically schedule to see them every 2 days or every other day. When I'm giving the patient instructions for home care, how to treat their injury at home, I'm going to include advising them to use ice therapy like you used in the clinic. I'm also going to advise them to use the anti-inflammatory drugs, over-the-counter anti-inflammatory medication, according to the directions on the label. I'm also going to advise them to do gentle stretching exercises. So I don't want them to do any stretching that's going to cause them a lot of pain. But the goal is to keep those muscles loose. If the patient has a back injury, goes home and just lays on the couch in one position, that's not going to help. We want to loosen those muscles up just a little bit. One of the ways we can help loosen those muscles up, along with the gentle stretching, is using something we call wall ball or gentle massage. Now, if the patient doesn't have someone who can give them a massage, they can use a tennis ball, place the ball in between their back and the wall, and just kind of massage their own back with that tennis ball. The great thing about that is they can actually target where the pain is, where that muscle is tight with that tennis ball. So I'm also going to let the patient know that it's okay to use pain relieving gel. I know we use BioFreeze here, but really any over-the-counter gel that's made for back pain is okay to use. One of the most important things that we do with our patients here at the clinic is education. With a back injury, I want to educate the patient on proper body mechanics, proper posture, proper lifting techniques. So when I'm documenting my encounter with a patient with a back injury, I want to be sure to use the SOAP method of documentation. I'm going to document what the patient was telling me. I want to document what I see, and I want to document my findings. I also want to be sure to document any improvement that I see. Did the patient respond well to the ice and the biofreeze that I did in clinic? That's going to be all part of my note. So thank you for joining me as I went over the assessment of the patient with a back injury, and I hope my demonstration will help you hustle and deliver quality patient care. I'm ready. Oh, hi. I didn't hear you come in. My name's Will. I'm a nurse here. I'm going to start I'm going to start with a visual assessment of the patient's map. So,